This is Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. Here we discuss, dissect, talk about important health-related issues that matters to everyone. My name is Amazing Rita, and previously or last week we discussed about fibroid, how it affects the woman, the husband, the family, and the society at large. So please do well to check out our previous post and learn something today about fibroid. I'm not alone in the studio. Seated by my side is Dr. Dimba Favor. Hi, Dr. Favor.
Hello.
You're looking beautiful, by the way.
Thank you so much.
You're welcome. And today we'll be talking about something very important, hepatitis B, which is a silent threat to your liver, and how people can be living with it without showing any symptom. So sit back, tighten your seatbelts, because we promise it's going to be an educative ride. So, Dr. Favor, tell us, what is hepatitis B?
Okay. Generally, hepatitis is an inflammatory process that the liver undergoes. So when you say hepatitis B, it's just one of the viral causes of that inflammation the liver can undergo. There are different things that could cause the liver to undergo that process of inflammation. You have drugs, alcohol, various things, viruses. So in the list of viruses, hepatitis B is one of the viruses that can cause inflammation of the liver.
Since you called it B, is there like
Yes.
A, C, D, E?
All right, we have hepatitis A, B, C, D, E, F, up to G.
Oh my.
Yes.
Okay, so how does it actually affect the liver?
Okay. For hepatitis B, it starts as an acute process. Acute in the sense that it's below 6 months. So once it extends above 6 months, it becomes chronic. Majorly, it affects the liver hepatocytes. Hepatocytes are the cells that make up the liver. Yes, so that's what hepatitis does. The virus goes to replicate in the hepatocytes, that's the liver cells. From there, it could progress. Like I told you, below 6 months is acute, and above 6 months is chronic. So in the course of the progression, it could lead to chronic liver dysfunction, could lead to liver cirrhosis. Cirrhosis is a case where those hepatocytes are being replaced by necrosed tissues. It could further move to hepatocellular cancer because it's one of the causes of hepatocellular cancer. However, hepatitis C is the major cause of hepatocellular cancer.
Okay. All right, so for hepatitis B, how do
Yes.
people get infected with it?
For hepatitis B, there are various risk factors for it, and you have something like sexual workers who practice unsafe sex. Yes. You also have intravenous drug abusers, people who use intravenous drugs, they abuse it. That way, they are being exposed. Healthcare workers are at risk because they're at risk of needle puncture. Yes, the needle of syringes. Let me say you've used it on an infected patient and then you mistakenly have a prick on any part of your body. You could go ahead to get the virus. Blood transfusion is another means. When the blood being transfused is not properly screened, so that person could be transfused with that blood, and then the blood is containing the virus. You have people who undergo hemodialysis. Hemodialysis is a form of dialysis in people who are having liver failure, where their body can no longer purify the blood. So hemodialysis is a form of dialysis, so they are also at risk of hepatitis B. Yes.
All right, so you see, if hepatitis B affects the liver, you know there are some diseases, infection, sicknesses that start from a particular place and then it travels or infects something else.
Yes.
Does it have the tendency of infecting another part of the body, another organ or whatsoever?
Okay. Just like I previously said, it can progress to hepatocellular cancer. So, in cancer, there's something like metastasis. Metastasis is like a spread.
Right.
Yes. So, in a patient who has progressed to hepatocellular cancer, that liver could be the primary site of the cancer, and then from there it could spread through
Right.
the blood, through the lymph nodes to other parts of the body. Then someone also who has progressed to having cirrhosis, and then it's affecting possibly the bile ducts because they are all located there. So if it's affecting it, a there could be a blockage in the excretion of bile.
Let me take you back to it being how people get infected by it. You
Okay.
said unprotected sex.
Yes.
What about saliva, kissing?
Yes. So in the blood, in the serum, and in exudates from wound, they are the body fluids that contain the highest percentage of the virus.
Okay.
While the saliva, the semen, they contain moderate quantity of the virus. Then urine, feces, tears, breast milk contain the least quantity of virus. So saliva has a moderate
Okay.
quantity of the virus, yes.
Can you get infected by sharing food with someone who is infected with hepatitis B?
No, you can't.
Sharing spoon, uncle.
For that one, it's not.
It's not that
It's not
simple.
proved.
Okay.
Yes, it's not like something that is proven yet. And then I would say it's not certain yet. But it could be a possibility. Like in medicine, you never can say never. Yes.
All right. So between newborns,
Okay.
adults,
Okay.
and let's say drug users,
Okay.
who are the people that are at higher risk of contacting hepatitis B?
Okay, like I told you, there are various things that could expose a person to hepatitis B. For a newborn now, if the mother is already a hepatitis patient, that she has the hepatitis B surface antigen, because it's the surface antigen that's the marker for infectivity. Yes. So if she has the hepatitis surface antigen, in utero, that child is already at risk of contracting the virus. Yes. So for a drug user, like I told you, people who abuse intravenous drugs, because you don't know if someone else having the virus has already used the sharp he or she's about to use. So they are also at risk. And the last group of individual you listed was
The adults.
adults. Yes. So like I told you, it's also depending on the factor. Like this adult could have been transfused blood that is contaminated, and then the person can contract the virus. So I won't say this set of individuals have a higher risk than this set of individuals. Yes,
All right.
because various factors could be in play.
So, is there a tendency of someone to be living or having hepatitis B and not know it? The person will show sign, no symptom or whatsoever.
Okay, it's a possibility, because majority of times we've had cases where a patient comes diagnosed of hepatitis, but not as if he or she presented to the hospital because he or she knew he was having hepatitis. Yes, it's like an incidental finding most of the times. Yes, in like 80% of cases where we've seen, just see patients, maybe they come to the GOPD, I'm feeling weak, headache, and they list a number of symptoms. Then they send them for investigations, and along the line, the viral screening, hepatitis comes out positive. Or some people, they go for donation to donate blood, and then screening for viral infections, hepatitis comes out positive. So it's a very big possibility that someone has hepatitis, but it's just living his or her normal life. And then it also depends, because it could be in the acute phase. Yes. Possibly the person just got exposed to the virus. Yes.
All right. Then, what are the symptoms of hepatitis B?
Okay. Hepatitis could, like I said earlier, it has an acute phase, and then a chronic phase.
Yeah.
The acute phase has the pre-icteric, the icteric and post-icteric phases. When I say icteric, I mean the phase, the period where the jaundice, icterus is just like jaundice. Jaundice is like the yellowish discoloration of the sclera, the skin, the mucosa, like the oral mucosa and everything. Yes. So that's what I mean by icterus. So for the pre-icteric phase, the person could come with symptoms of weakness, loss of appetite, anorexia. Anorexia is like you're having this feeling to throw up, but you're not throwing up yet. It's just a feeling. That's anorexia, loss of appetite. So these are some pre-icteric symptoms the person could present with. Icteric symptoms, person is already coming down with jaundice. You could see the sclera, that's the white part of the eye, is already very yellow. You could see the person having yellowish discoloration on the skin. Sometimes the buccal mucosa, like the mucosa of the mouth. Yes, the person could present with icterus. Sometimes it could go as far as myalgia. That's pain of the muscles. There could be joint pain. The person could present with constipation as well. Then the post-icteric phase, the person could present with deep colored urine, very yellow, very, very yellow. Person could sometimes come down with gradual edema. The leg starts getting swollen. Yes. So these are some symptoms the person could present with.
So, for someone living with hepatitis B
Okay.
and not knowing it, probably it's in its acute stage.
Yes.
Can the person spread it?
If you do the investigation and then the hepatitis B surface antigen is positive, the person can spread it. That hepatitis B surface antigen confers infectivity. Like I said earlier, once it's positive, the person can spread it.
Okay, you also talked about body fluids.
Yes.
Can it be can a person spread it through sweat?
No, for sweat is not in the list, in the previous list I described, showing the high, moderate, and low, contained viral fluids. Sweat is not among it. Yes, majorly anything that could go into the body. Exactly. Anything like sweat is on the surface. So for hepatitis B, sweat is highly unlikely to be a source of transmission.
All right, then how come it affects, like people call it like a silent killer,
Yes.
just like high blood pressure.
Okay.
So why is it called that?
Silent killer. Okay. Like I said earlier, some people don't even know that they're having this hepatitis. But like I said, we've seen cases where up to 80% in a case, let me say in a situation where we have 100 people, 80 of those people is just an incidental finding. Yes. Like I told you, the early symptoms, the pre-icteric symptoms, you're just feeling weak, loss of appetite, anorexia. You know, these symptoms are also mimicking symptoms of other diseases. So this person could just be there treating malaria and the rest, not knowing that he's actually down with hepatitis B. So most times, like I said, in a case of 100 people, out of the 100, 80 is just an incidental finding. They discover that this person is having hepatitis B. Yeah.
So if left untreated,
what happens?
Yes,
Okay.
what happened?
Okay, hepatitis left untreated, like I told you, it progresses. Yes. Remember, the liver has a lot of functions. And hepatitis, the major target is the liver. Yes, so I told you it progresses from the acute phase, it could go to chronic phase. But in between this, from when the person gets exposed, and then it starts affecting the hepatocytes, that's the liver cells, the person could come down with cirrhosis. Remember, the liver is one of the organs in the body that has the ability to regenerate itself. But like you said, if left untreated, it progresses, cirrhosis will occur. And depending on the extent of injury to the liver. If the injury is too much, the liver cannot regenerate itself. That's why it's good it is caught young. But like I said, people don't really know that I'm down with hepatitis. Exactly. So from cirrhosis, it could even further go to insufficiency, hepatocellular carcinoma. So thereby the liver is destroyed, and at that stage, the only remedy is liver transplant, which almost always has little success rate.
Okay.
Yes.
So, is since you've been a doctor,
Okay.
is there any case where you've actually seen where somebody, without treating it, the person recovered?
Okay.
Like maybe the body fights it, or the liver regenerates and becomes stable. Is there any case? Has it ever happened?
Okay, during my practice as a doctor, I've not seen a case like that. However, it's a possibility. The reasons are this. Normally, generally, viral diseases are self-limiting. That's like generally viral diseases are self-limiting. What do I mean by self-limiting? The body handles them. Do you understand? Yes, the body creates an immune response to viral diseases. It handles them. They are self-limiting. But then it also depends on the extent. Yes, if the individual just got exposed to this virus, and then these symptoms, if it's detected early, like I said, you could treat symptomatically.
Yeah.
Because majorly the acute phase of hepatitis is treated symptomatically. Yes, you treat the symptoms this patient is having, including dietary modifications. And then if there's a way, the liver regenerates itself. Because, like I said, it depends on the extent to which this liver damage has occurred. Yes, so that's why I said it's a possibility. I've not experienced it in the period of my practice, but it's very possible.
All right. So, is no? Some people are hearing about it, but like cancer, before we used to think cancer is white man sickness, or Nigerians, or black man. It doesn't affect anyone. How common is it in Nigeria right now?
Okay. Hepatitis is quite common in Nigeria at the moment. Like now, you have a lot of people abusing intravenous drugs. You have a lot of healthcare workers. So all these people are at risk of hepatitis B. All those people in the rural areas who are not even aware, yes, they go ahead to have unprotected sexual intercourse, homosexuals. The rate of homosexualism is quite on the increase. So all these things are further increasing the risk and the rate of hepatitis B.
Can it be genetically inherited?
Family history could be, however, could be one of the risk factors, however, not a major risk factor. Yes, because like I said, a newborn now whose mother had the hepatitis B surface antigen, if appropriate measures are not taken, it could be transmitted in utero, through the placenta, or during delivery. Yes, so why I said family history may not be an important risk factor is this: provided appropriate precautions are taken, so it could be curbed. Like now, a woman takes in, she has the hepatitis B surface antigen. Once she registers for antenatal and this is picked on time, there are measures to handle it such that even during delivery, it won't be transmitted to the child. Yes.
So you just talked about a woman and a child. So can someone who has hepatitis B breastfeed?
Yes, just like I said, once the woman gets registered for antenatal care, and then it is picked on time, because that's one of the baseline investigations to do, and it's picked on time, they will place her under high risk pregnancy because of the hepatitis B. So she could breastfeed, but then before going into breastfeeding, right from her antenatal visit, yes, she'll be checkmated on various things. During delivery, breastfeeding, post-immunization, those are various steps she will need to undergo. Yes.
Wow, thank you so much,
You're
Dr.
welcome.
Favor. So, a woman who is pregnant or is breastfeeding, a woman who is breastfeeding should not be scared of transmitting hepatitis B to
Yes.
the child through breastfeeding. All right.
Excuse me. Provided she was
Provide.
regular with her antenatal care visit
Okay.
and she followed the the directions and
Yes.
instructions she was
Okay.
given. Yes. Not just a random woman who didn't attend
Attend and
antenatal
okay,
and
and
then
didn't do anything about it.
beautiful. There's a risk of her transmitting the virus
So
to the
there's a
child.
vaccine.
Yes, hepatitis B has a vaccine.
So while the woman is pregnant, so she would have gotten the vaccine then.
Proof she has the virus already, so
Yes.
vaccine would not do
Not do
anything
anything.
much for her.
Ooh.
Vaccine does much for people who are not yet exposed to the virus. It
Okay.
provides like a form of immunity
Okay.
for years.
Oh wow. Okay, so when is it advisable for people to get tested for this? Like, is there an age range or time range? Maybe in a year, 3 times a month, or those who are sexually active, those who use hard drug, or when is it advisable?
Okay, there's no fixed duration of time, but then I would say you could just go for a random checkup. You could give an interval of 3 months, and then every 3 months you go for a checkup just to ensure you're free from the
Free.
virus. Yes. For those who are sexually active and don't practice safe sex, when they expose themselves, it's important
They
they
get
go
tested.
for beautiful. And there's no, I won't say there is a fixed time to say maybe every 3 months you must go for a check. But however, to be on the safe side, you could go for a check three
So
months.
is it advisable for teenagers to also go for?
Of course, it's very advisable because teenagers, even little children, because they play when they go to school, they play with their friends, they play with their classmates, they use sharps. This maybe they could be playing and then a blade gets into the finger of this person. He cuts his friend's hand with a blade, and you don't know if that blade has been infected with the blood of someone who has the
Even
virus.
from barber
Share
shop.
beautiful. So all these are reasons why you should go for a regular check.
So
Yes.
how effective is the vaccine?
Okay, I would say the vaccine is about 95% effective. However, this vaccine is not just a single dose.
Dose.
Yes, there are 3 doses of the vaccine. But remember, like I said earlier, this vaccine would only be helpful to someone who is not yet exposed to the virus. Yes, there should be an interval of at least 16 weeks from the first to the third. The first dose of the vaccine is given at contact when you meet the person and the person came to take the first dose of the vaccine. The second dose is given 4 weeks later, ideally, but it could be extended to 5 weeks, 1 month, 4 or 5 weeks,
Okay.
while the third dose is given 8 weeks later. Do you understand? Yes, the first dose on contact, second dose 4 weeks later, third dose at least 8 weeks later. Some people go as far as 3 months later. Yes, so you have 3 doses of the vaccine, and then you could have something like booster doses.
Okay.
Yes.
All right. So we will be talking more about the treatment. We'll also talk more about how people can manage hepatitis B, that is for those who are infected. We'll also be talking about how people who are infected can help curb it from spreading. And these and many more are what we'll be talking about on the next episode of Health Unplugged. So do well to like, share, and subscribe. My name is Amazing Rita, and I have with me Dr. Favor. So till we come your way again, I know you have questions, but you can drop your questions in the comment section, and I promise you will do well to answer all your questions. And do not forget, keep a date with us next week as we'll tell you more on hepatitis B, how it affects you and how it affects people around you. Thank you so much for joining us. We'll see you next week. Bye.
Bye.